Aloha, Hawaii. It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Hello there. You know, a big popular thing shopping these days is BOGO. Buy one, get one free. Or two for the price of one. This is a interesting program because it's a threefer. And let me tell you how it came about. Dr. Juliff and I were talking a program or two about the lymphedema system. And I thought, wait a minute. Are those veins or arteries? Nope. It's a whole nother thing that's going on in your leg. That's why I say it's a threefer. We're going to talk a little bit about arteries, a lot about veins, but today's subject is lymphedema. And I know from personal experience that if somebody says you have edema, this is not good. All I know, you tell us about the rest of it, but edema means swelling.
That is absolutely right.
See, I'm almost, I'm on the cobblestone to the dusty, dirty road leading to the superhighway of medicine, but I'm getting there.
Yeah. Yeah, you know, edema is a very general kind of term, but it always indicates or suggests swelling somewhere for some reason.
Okay, now, when we talked about lymphedema, the reason why I wanted to, see if we could do a program about this is because it came up in a conversation a couple of programs ago. And that was that when people get really big or when they have a problem with legs swollen, sometimes they actually have fluid actually coming out of their legs. And so I'm thinking, is it from a vein or an artery? And said, no, it's a different system.
Right.
This lymph system.
Exactly.
What's the function of the thing?
Well, there's a lot of just clearish kind of fluid that is always going through our body. I mean, our body is 70% water.
Sure.
And there's the arteries and the veins, and as we've talked about, the arteries are the blood vessels that carry blood from the heart as the heart pumps to all of our body areas. Veins bring all that blood back, but when the arterial blood is going through the smallest of little arterioles, is what we call them, very, very small.
Very, almost tiny, right?
In the capillary system. There's some clear fluid that goes outside of the actual vasculature and is in the what we call the soft tissue of the body.
So my question is, unlike the veins, those are hoses that do this. There's not blood outside the vein; it's all inside the vein.
Yeah, the blood stays inside the blood vessel.
But does the lymph system, does it have a highway or a transport, or is it just floating around in there?
There is a transport system, and that's the lymphatic channels, or vessels. You can use either of those two terms. It's something that you don't really hear talked about that much when you're in high school, let's say, or even college. Anatomy, physiology.
Where you've heard somebody say, "Yeah, let me see, those lymph nodes of yours are swollen."
Yeah. Now lymph nodes are part of that system, part of the lymphatic system. But the lymphatic system at the most peripheral area are very, very tiny, smaller than arteries and veins.
Wow.
Just tiny little channels made up of, a single cell kind of covering of a channel. And those are the channels that then absorb the clear fluid that is out there, in Never Never Land.
Yeah.
And it needs to come back.
To me, that's fascinating because it has a big purpose.
Sure.
But it looks like it's just taking up. It takes up the same space as the stuff that you do with. So how often does a vascular surgeon like yourself get into something that has with the lymph system?
Well, with respect to doing something surgically about it?
Or either that or making it move away so that you can get at what you need to do.
Yeah.
I'm looking at the leg, I'm looking at the skin. Let's open it up and look inside. A lot of stuff in there.
Yeah. When you make an incision, for instance, in the lower part of the leg somewhere, and you kind of, like, as you say, look inside.
Yeah.
It's not like you're going to see lymphatic channels at that level.
Gotcha.
Now,
that's what I needed. I think everybody needs to know that.
Yeah, those channels then funnel into larger and larger lymphatic, vessels, and as it progresses up into the pelvis and into the trunk of the body, then there are fairly large lymphatic type vessels there that you can actually see. So and that's those channels are carrying the blood upward through the pelvis and abdomen, and then ultimately into the chest. And then it ultimately gets the fluid back to the normal vasculature. It empties into a large vein in the upper chest.
Yeah, see, and I was going to wonder about that, because I'm wondering at what point in time it becomes a nuisance when you're trying to deal with other things. Obviously, there's a purpose. So maybe everybody, okay, now that you know we have a word called lymphedema, edema means swollen, what's the purpose of that whole system?
Well, the purpose of that system is to return all of that clear sort of non-blood fluid that's out, just circulating throughout the, soft tissues of the body, in collecting it and getting it back into the vascular system. So that's the purpose.
Okay.
Now, you mentioned lymph nodes. Lymph nodes, and I think everybody kind of has a nice idea about what lymph nodes are. When
you can almost kind of feel them.
Especially in your neck.
Yeah.
And we have them in the armpit and a variety of in the groins, But there's a bunch of lymph nodes all over our body, centrally through the chest and the abdomen too. And the lymph nodes are actually filtering that fluid. The lymph channels are then transporting this fluid through the regional lymph nodes. And and those nodes actually filter that fluid, and it's picking up things like what we call cellular debris.
Yeah, just like vacuuming the halls out.
It's a sanitation system. Yeah,
it's incredibly interesting to me, gang. And one of the reasons why I wanted to get into this and ask Dr. Julep why we're going to be doing this is primarily because I when I saw the word edema, I know what swelling is. And in some cases, that must mean the nodes or a swollen tissue as a result of having this lymphatic fluid in there. It's trying to tell you something. I mean, it creates a symptom. And if it gets a symptom, you're going to say, I got to go see a doc. I got to find out what's going on in here.
If the lymph nodes and the lymph system is functioning properly, then no, the lymph nodes are not going to become enlarged just for that reason.
Okay.
However, there's plenty of other reasons why lymph nodes get large, and day to day, it's because of infection. I mean, if somebody has an upper respiratory type infection, that's when they feel the nodes in their necks. Or if they have an infection on an extremity, then you're going to see nodes either in the armpits or the groins. But if the system is functioning properly, the fluid flows well, and it goes back up again through the chest and back into the circulation. And just to give you an idea, the amount of fluid that the lymphatic system is transporting over the course of a day is about 8, or can be up to about 8 liters of fluid.
That's a lot.
That's a lot.
Yeah.
That's a lot.
30, 40 pounds of it, right?
Yeah.
But wow. Now, on a good day, that must mean that this is good. It's going into the closet. It's sweeping up all of this stuff, taking it up to get it filtered out. But from what I understand, and I read some material that you provided me, and I also heard this before, that it actually the lymphedema is more likely to happen in the legs, and I'm just guessing, because that's the bottom of the guy or the gal, and that everything's happening in the legs.
Right. Yeah. Same reason that venous disease affects the legs more than other parts of the body. Our legs are in what we call a more dependent position. We spend most of our life in an upright, standing position. The most hydrostatic pressure, moving downward because of gravity and because we stand up straight, is in the legs, and that's why it happens there. But 90% of the time when we talk about lymphedema, it's usually in the legs, unless it has something to do with surgery. In the arms, and we'll talk about that a little bit.
And this is interesting. And by the way, it's one of the many things that you can learn and see at veinclinicsofhawaii.com, veinclinicsofhawaii.com. Goes off into all kinds of things. And so now, however, as a patient and as a person, I'm wondering, are there symptoms that are specific to lymphedema that are also can be for a venous condition or even an artery condition? I mean, I don't know.
Some of the symptoms are similar for vein disease, as well as lymphedema. Arterial disease, no, not so much, because typically you don't get swelling and the discomfort kind of things that you get with venous disease in arterial problems. But some of the symptoms are the main symptom is swelling, obviously, and usually it's painless.
See, we were talking about this before. Sometimes different people have a different thing, whether it's burning, whether it's cold, whether it's tingly, whether it's numb, or whether it hurts. Those are sometimes the symptoms that the different people would have with regards to venous disease. Are there some, because you say it doesn't hurt, but it certainly looks like you must be able to tell if one leg is more than another. Did it happen in both legs?
Sometimes it does, sometimes it doesn't.
So it can happen in just one leg.
It can. It can, yeah. Also, unilateral lymphedema, often that kind of makes you think more of either, post-surgical or traumatic or those types of things that might be happening just to that extremity. But some of the other things that we see, after just generalized edema, is that it does start with time to affect the skin, the quality of the skin. And that's what then ultimately leads to potential problems, just like in venous disease.
By the way, gang, one of the numbers that frightened me was that there's about 200 million people in the world that suffer from this. So that means, or that have this condition, that means it's really not all that common. I mean, I'm sure that you see as a practitioner lots of it, but I don't know if there are lots of people that have it. It seems to me that if there's 200 million people in the world, that sounds like a lot. If it were here, it'd be 50% of the population or more.
Yeah.
But it's really a smaller percentage.
Yeah, it is overall, yeah. But I think that doesn't really, that number, although it's, when you look at it as far as worldwide, it's not a huge percentage of people, but there's probably many, many more than that actually have some degree of lymphedema. And they don't get evaluated. It's not that bad, or it's a part of something else. I think interest in lymphedema over the past 10 years or so has gotten a little more we've gotten a little more concerned about diagnosing it and doing something about it. Lymphedema also kind of often runs in the same gang as venous insufficiency. I mean, they're buddies. They often are buddies.
You've talked before, and this is very interesting. Dr. Julep, we've talked about this before. The 4 clinics, started on the Big Island, were Maui, Kauai, and here on Oahu. And you can reach them all through veinclinicsofhawaii.com. There's phone numbers there, the individual ones, if you want to call and make an appointment to get talked to. But I'm wondering what drives people to have lymphedema looked at. Because you say that it, in a lot of cases, it's not necessarily painful, but are there other sensations or feelings outside of maybe heaviness from being swollen?
That just the leg becomes sort of heavy and cumbersome, but early on in the the initial stages of lymphedema, it's mainly that. However, as it progresses, then that's when we start seeing the other more medical related kind of problems with discoloration of the skin. The skin becomes much more thickened. They talk about it having a kind of a cobblestone sort of appearance. It becomes very rough.
Yeah, like you said earlier. But it seems to me that that's the case. The symptoms of it, or some of the things that manifest that show from it, can also be attributable to other things, like people with bad venous conditions or ulcers, which we're going to talk about again. Is that there has to be a very thorough vetting of what kind of condition is this? It's swollen and it's painful, or it's not. It's in the leg. Is it the vein, or is it the lymph system? How do we tell?
Yeah, well, that gets back to looking at ruling those things out. Practically everybody that we see with a swollen limb, they're going to get an ultrasound to look at their venous function.
Okay.
Which brings up a interesting point, and that is what I was mentioning before. Often people have both.
I'm sure of it.
It's usually it's
comorbidity, right?
Yeah, it's usually not just one or the other. The venous insufficiency and lymphedema all often kind of go hand in hand. And there's some suggestion that having venous insufficiency for a long period of time will actually lead to the process of lymphedema. So that's where I wanted to go. And let me tell you, gang, those of you that say that might be me, it really could. I do want to remind you that although this is a medical show, the opinions being rendered to you out there in Radio Land are
are not substantiable. So what you need to do is, if any of these things cause you to be interested or concerned, you got to call your doctor. You can call Dr. Juliff. You can call the Vein Clinics of Hawaii. And I'll tell you why, because the next question seems to be, we know from previous, and we're going to know going into the future, there are a myriad of different ways that you can treat to manage, varicose veins, the good, the bad, the little ones, all the way up to the very big ones. What about lymphedema? Are there also treatments and procedures and things that you can do for that condition?
Yeah, there are, sure. Getting back to patients or people just in general who have swelling, that is one of those symptoms that people are able to ignore. One of our prior shows, we talked about symptoms that people can ignore, and sometimes it's amazing how much
it only hurts a little bit.
Yeah,
but for 4 years, it's been a little bit, right?
Yeah, exactly. And swelling is one of those things that people are able to ignore because it doesn't bother them tremendously, especially if it's painless. If they're not having any pain or any major kind of symptom from it, it's easy for them to ignore it. And they also come up with excuses as to why they have it. Well, I've always had it, or
my dad had it.
Everybody in my family. Well, it's just big legs.
I found out something, and this was right after our second or third show, first or second show, that a guy asked me. He says, a lot of times the men are like macho, and they don't care what their leg looks like. I know they, in actual fact, they do, but they say, what do I care? I'm an old bugger.
Yeah.
Man, I can handle the pain. I don't need a doctor. That person is cruising for a not good ending, isn't it?
Well, yeah, it's something that they shouldn't ignore. If there's something that's not out of the realm of normality, typically there's a reason for it, and it's worth looking into. Because, it can always lead to worse problems down the line if you don't. I
know that you are a very busy surgeon, and that your practice is really venous surgery. If somebody was really a serious victim or a serious lymphedema patient, would that person be treated the same way, or would there be another guy or gal that specializes in lymphedema? Well,
we rely on other people also to help us treat lymphedema, but we treat lymphedema in our clinic every day.
Yeah. I knew that. I kind of heard that, but I wondered if there's lymphedema and then there's lymphedema. Right now I've got, varicose vein issues, but I've had a lot of treatment, so I have varicose vein issues, but they're not threatening ones. So I'm wondering if the same thing is true with lymphedema patients, where sometimes a little bit maybe can change. What can diet help? Can exercise help? What, in addition to a procedure, can help somebody that has that?
Well, when we treat people with just in general swelling of a leg, number one, we need to figure out what it's all about. So we do an ultrasound and find out if there is venous insufficiency. Yeah. And again, often many of these people do have both.
Both, sure.
They have venous insufficiency and they have lymphedema. So the venous insufficiency part of it is a little easier to fix in a quick fashion. So we usually do that. And so that is taking venous insufficiency out of the equation. So after we fix the veins, then we're left with, whatever amount of swelling might still be there, and that we presume is due to lymphedema.
Boy, that is a gift, isn't it? Obviously, your practice and your desire, your heart anyways, is in this venous surgery. So, and there's a beginning, a center, and a finish. It may not finish it for something coming up later, but you identify a problem, you can fix it.
Right.
Similar roads for lymphedema? Are there similar things that can be looked at?
Unfortunately, it's not as easy
with
lymphedema. Yeah. And there are other things. But, getting back to the diagnosis, even the diagnosis of lymphedema can be a little elusive at times. And often, what we end up doing is ruling out other reasons why somebody might have lymphedema, might have swelling of a leg. And then if everything else is ruled out, then we assume it's lymphedema, and that's often
adequate. That's the way it was a little while ago, gang, just a few minutes ago. So what I'm retaining, and I think you are, is the doc was saying that somebody comes in with a swollen leg. There's a number of tests that you do to maybe not fix it, but to eliminate what's causing it. And so if you determine, Doc, what you said is if there's both things going on, lymphedema and venous condition, the venous condition is highly visible. You can see it. The ultrasound can treat it. And with the procedure too, that is going to be healed, at least for now. Everything is okay.
Correct.
So now the guy says, well, yeah, I'm glad you fixed me, but geez, my leg's still killing me. Yeah, so what are we going to do with that guy?
And we hear that often.
yeah. Don't blame me. I'm the Venus guy. No, I'm kidding. Yeah.
But there's a fancy test called lymphoscintigraphy.
Oh, boy, here we go. Yep.
You want to repeat that after me?
Lymphoscintigraphy.
Yeah, that's good.
Don't ask me in 5 minutes because that's not going to work.
It's a nuclear medicine scan that actually is probably the best single modality that we have to really make a diagnosis of lymphedema. Yeah. Unfortunately, you can't get that on the corner X-ray company.
Sure.
Not everybody does those, so it can be a little difficult depending on where you are to get a study like that to make a firm diagnosis. Sometimes we use MRI, sometimes we use CT to kind of help us, assure the diagnosis of lymphedema. But typically, when we put the whole picture together, when we take venous insufficiency out of the equation, when we are able to examine the patient and look at the extremity, lymphedema has a fairly obvious kind of appearance. Mm-hmm. And so then we, kind of are left with lymphedema, and then we go on to, do what we can to make it better. Now, unfortunately, most of the time, lymphedema is not something we cure.
Yeah, okay. And so there's no carrot out in front of the horse here, gang. But you need to get identified because what you can maybe not cure it, but you can certainly manage other comorbidities, right? Or co-things that are going on.
Well, we can't, absolutely. Well, we can fix other things. Maybe they need to be on a diuretic. Mm-hmm. Maybe they have venous insufficiency and we have to fix that. Maybe they need to be on a little more active exercise program. Yeah, there's all sorts of, kind of ancillary things that we can help. Mm-hmm. But with respect to how we handle lymphedema itself, the mainstay is compression.
Yeah, and you know what? This is going to cycle. I was going to say raise its ugly head, but this is going to present in almost everything we do. And I know a lot of it is counterintuitive when you think, well, if you're going to squeeze me, isn't that going to make it worse? No, but I want to make sure that we don't depart from, lymphedema is more than an inconvenience. If it goes unchecked, you've seen some of the horror things, right? I mean, not every person that has lymphedema just has a swollen leg.
Right.
What other things does it look like?
Well, the thing that ultimately happens is, again, abnormalities of the skin, and its integrity.
What about size of the leg?
Definitely. It will.
I've seen some really big things that they said: emphysema, congestive heart failure, diabetes, etc.
Yeah. With lymphedema, the extremity can get much larger than those other things that you mentioned. So compression is the mainstay, and we have to often kind of figure out what's going to be best for any particular patient. We start with just standard compression stockings.
And by the way, I'm looking at this because I'm wearing them as we speak. If I have lymphedema, I probably do. So what happens, though, it becomes a side benefit. If you're being treated for lymphedema with compression stockings, if you have a venous condition, guess what? You just helped it a little bit.
Sure.
And vice versa.
Sure. Yeah.
Yeah, okay, so now when you said another thing, everybody knows in the very beginning, those of you here in Hawaii remember when these MRI machines first came here. They were extremely expensive. They were claustrophobic. They were, most of us couldn't get into the darn things.
Yeah.
But from what I understand now, like everything else, technology has come a long way, and so you're likely to find them at the corner X-ray place. Is someday this other procedure going to be probably more,
lymphoscintigraphy?
Lymphoscintigraphy. I knew it was. I can't believe I said it twice. If that is, it seems to me that diagnostically, that's the cat's meow. That's the winner.
Yeah. Well, most major institutions, hospitals, et cetera, will have that available. So, most parts of the country you're going to be able to get to it, but there's plenty of smaller to moderate sized hospitals that don't do a study like that. But MRI is always available. But MRI even now it's not a cheap study. So we have to make sure that we're spending our healthcare dollars appropriately.
Yeah, interestingly enough, friends, when we talk sometimes about actual cases and patients, which we do, and one recent program we had one where somebody kept going to other practitioners in other fields and not getting the answer they needed. When they ended up in Dr. Juliff's office at VeinClinicsOfHawaii.com, you perform an ultrasound test, and this guy had no idea what was going on, but the weight lifts off his shoulders because now he's got an answer, and that was because of diagnostics.
Mm-hmm. Yeah. And again, it was ultrasound that did it, and it did it immediately, and in a painless sort of fashion. It's a great tool, as we've talked about. But we start. So once we've identified lymphedema, we start with standard compression stockings. Now, sometimes people can't wear them, or they're too uncomfortable, too hot, especially in a state like Hawaii, or they're just not doing the job. And if we don't do well with compression stockings, then we usually go into a wrap sort of bandaging of the leg, and often this will be several layers of wrapping that we utilize to really put a fair amount of continuous compression, and we usually get good results with that.
It's kind of scary, I must tell you. It's scary for some people, and I was thinking of you the other day because I know that and by the way, you can, through Dr. Juliff's office, Vein Clinics of Hawaii, you can get some of these compression garments and these other devices, and the way to properly use them. Because I happened to see, I was in a pharmacy, and I saw something I hadn't seen before in the area where there were braces and this and that, and there were compression socks. And I thought, wow, they're only $20. I'm going to get some of these. But then I thought, wait a minute. I made the mistake of thinking that my garment, my device, is a sock. And if you're thinking, because you buy socks, us guys do, at $3 for $10, right?
Right.
The wallet, the impact to the wallet on these things. But isn't it true that they're only socks because they look like socks, but they're really not socks?
No, well, there is true engineering involved in not only developing these stockings but also making them. But we call them graduated compression stockings, and the reason we call them that is because lower around the foot and the ankle, the pressure is the highest. The amount of compression.
It's furthest away from the heart and the lungs. Right?
And you're trying to move that fluid in an upward direction. So that's why we want the most pressure down at the bottom, and then as you go up the length of the stocking or the length of the leg, then the amount of compression is decreasing. But there's an adequate amount of compression throughout the whole thing. Ask any patient that's worn them.
No, listen, I'm going to tell you, if you can just get past that hump, and I'm telling you, when Dr. Juliff and I met, and we have mutual friends, we've been sort of around the periphery of each other for a while, but since we came acquainted, the biggest thing you can do is that compression. And we're not just talking about people that are, in the final end stages of horrific veins. We're talking about athletes and performers and tennis players and a lot of other people that maybe just don't understand. I'm glad to see that some of the sports companies are coming out with really compression socks. And that's for that reason, isn't it?
Well, and there are athletic sort of reasons to use compression in certain situations too, just to make performance a little better.
Exactly. Every little bit helps.
You may not have lymphedema or venous insufficiency or anything, but we have found that a certain amount of compression. A lot of athletes use compressive sleeves, which is on the calf, and it actually helps muscle recovery when they're running or doing whatever they do.
Okay, now you and I, listener, are probably not at that level, but I'm sure there's some of you are. But what I'm just talking about, and this is almost every program, we're going to talk about this a little bit because it has become increasingly clearer to me that one of the best take charge things is to start watching what you eat a little bit better, get a little exercise, and wear those socks. One thing that you say, Doc, and I know this is the time of the year where people fly away and go do things, this is the biggest area where it's supposed to be. Do those ones over the counter in the drugstore, do they help? Is it better than nothing, or should they really get real ones?
It's probably better than nothing, but the real deal is so much better, and especially if you have any any of these types of problems, and you're on a long flight or on a long car ride or whatever, you really need decent, well engineered and well made compression stockings. No question about it.
Okay, now the other thing is, gang, and here's another deal. You might see somebody today, or you might have somebody in your house. Oh, you got to get these things. But from what I understand, it's an equal opportunity benefit that even if you're in relatively good shape, you are at risk when you're flying, particularly when you get older. Isn't that a bit of compression like an insurance policy in some respects?
Absolutely. Yeah. I mean, any amount of immobility, and you're absolutely right, especially in that the risk of that increases with age. No question about that. It benefits nearly everyone to have compression on when they're on a long plane ride.
It's that simple. And unfortunately for us living in paradise, most of our plane rides are pretty long ones. I mean, I don't think you need for a 30-minute puddle jump trip from one island to the next. But when you start thinking about it, particularly, and I guess this is a great question I think that I hadn't thought about before, is as a professional, they tell you that you got to be at the airport, like 4 days before your flight.
Yeah.
And that means that your actual inactivity starts when you get to the airport.
Sure.
Not just on the plane.
Right.
You might be 2 hours sitting down, not walking around enough, get on the airplane for 5 hours. Now you got 7 hours.
Mm-hmm. Yeah,
where things can happen.
That's true. Yeah, hadn't thought about that either, but absolutely.
And the other thing for me, some of you have had this experience. I do not take my shoes off in the airplane anymore unless I'm wearing my compression socks, because I don't think your feet swell in a flight as much as they do when you do. Because I had to get off a plane one time in Alaska barefoot.
Yeah.
I couldn't get my shoes, but it was very embarrassing.
Right, sure. Yeah, and cold.
And cold, yeah. But see, I think that we can have, little chuckles about some of these things. An ounce of prevention, right, with these socks.
Yeah, absolutely. So we start with compression, go through the stockings. If the stockings aren't enough, then we do a little more aggressive kind of wrap, and that brings about more compression. The next step is that we can use something called intermittent pneumatic compression.
This is getting very popular on other limbs as well, isn't it?
Yeah, well, it can be used in a variety of different ways. Intermittent pneumatic compression is a big cuff that goes over your entire leg. It's like a really long blood pressure cuff. That cuff is attached through a bunch of little tubes to an air compressor.
Okay.
And it intermittently will inflate. Now it inflates the cuff around your leg, and it starts the inflation down around the foot and ankle. So same sort of thing as the graduated stocking. We start the inflation down around the foot, and then it kind of makes its way up the leg. And in the process, it's pushing that fluid upward. So many people with lymphedema benefit from that. Now, obviously, that's not a device.
I was going to say, you're not going to wear it on a walk to the store or go to work, right?
No, you can't wear it at work. But typically we do it for 30 to 60 minutes twice a day. And if people do use that in a very, very persistent and scheduled sort of fashion, it can be tremendously beneficial.
Okay, my question on that is this: everybody knows that you have an owie, you put a Band-Aid on it. And pretty soon you don't have to do it anymore because the owie's closed. At some point in time, you must be lulled into a false sense of security that I'm better now. I feel good. I'm not going to wear these things anymore.
Yeah.
And isn't that where a lot of people fall out of the program and stop wearing the socks?
Yeah.
The stockings, right?
Yeah. Well, that's human nature.
Yeah.
But
when you say the thing is, if you cut out an hour, I don't know anybody, it's certainly not in my business, that gets up in the morning has an hour to spare.
Yeah.
Because you got to get up the door.
Well, that's another problem.
Yeah.
Sure.
But there are a lot of us that are still able to be part of the business world from home. There's a lot of people that maybe do. They can be at work with this thing on. But everything that comes up with that, is that something that would be, when you're being treated by your physician for venous insufficiency or whatever, is that something that would be prescribed?
Yes.
Yeah, can it be?
It can be, but actually, interestingly enough, recently I did see a device like that on Amazon.
Really?
So individuals can actually purchase those now. And I got a report from at least one patient who has lymphedema, and this is how I found out that they were selling them on Amazon. And he said that the quality is pretty decent. Now, excuse me. typically we can get this device if the patient truly has ongoing lymphedema that is not able to be controlled by other methods. Often we can get the device covered by insurance or Medicare. Yeah. It takes a little bit of paperwork, but we go through that. But if it doesn't, then there's always that option for commercial purchase of a device, and like I said, from reports, it's okay.
Okay, I got to go backwards a little bit because on one of our earlier shows, and a lot of what Dr. Juliff does in VeinCentersOfHawaii.com. I just say the .com so you remember it. VeinCentersOfHawaii.com. A lot of the stuff is elective. I mean, there's a lot of really cool things going on in that office. But when it gets down to the nitty gritty, I think that and for me, the socks that were expensive had to be expensive. But I thought to myself, gee, I paid a lot of money for these doggone things. I'm going to wear them. Yeah. And so that's why I still wear them, because I'm still stuck in that groove. But sure. in actual fact, I thought, you know what it really is? It's 5 lunches.
Right.
And if you look at it that way, you buy a pair of these socks. They can be anywhere, folks. I'll give you some hard numbers. From what I know, Doc knows different, but they can be anywhere from in the mid 40s, $50 up to $100. I mean, it just depends on the brand and I guess the complexity of the garment. And we've got to call it a garment, though. It's not just a sock.
Yeah, absolutely. Yeah, they can be a little pricey, but I think that's well put. One pair of high quality stockings is like going to lunch for 4 or 5 times.
Yeah.
And the stockings last a long time.
Yeah, that's good. And I know that, and I take very care of them. They don't do well in the dryer. I'll tell you that right now.
Yeah.
If a pair accidentally goes through the dryer, they do okay. But they're then for your midget, small friended cousin, because they're not going to fit my big luau feet anymore.
Right.
Okay, but I want to say that is a good way to get people on a treatment plan. That's why I asked you, and if you don't mind spending another couple of minutes on the severe cases of lymphedema.
Mm-hmm. Yeah. Well, and there's additional things that we do also, in addition to, the several that I've already mentioned, which basically has to do with mechanical compression of the limb. But something that we've sort of developed here also in more recent years is lymphatic massage. Mm-hmm. And usually it's the physical therapists that are doing that these days, and it's become a real important part of the overall treatment of lymphedema. So all of our patients, literally all of them that we are treating for ongoing lymphedema, we refer them to a physical therapist that does that kind of stuff.
I remember, and everybody can remember when Mom or Grandma used to say, "Come and rub your feet when you're in bed at night."
Sure.
Doesn't that feel nice? Grandma, how come you don't rub my feet anymore? Can this be a caregiver or spouse, a significant other, whatever, something they can learn to be sort of helpful in that area too?
They could, but I think it's probably best done by a physical therapist. But there's no question you could any amount of help that you get sort of on a daily basis is definitely beneficial.
I think the reason why I asked that, because almost everybody wants a light at the end of the tunnel.
Sure.
So I know as a practitioner, you must have to deal with telling some patients the cold, hard facts about what's going on with them, how long it's there, how can they manage it, and is it something that can be reversed? And some of the things that you work on can't be.
Right. Well, like I said, with lymphedema, it's never a complete cure. The leg is never going to be, like it was when the patient was 18. But we can really optimize their status. And it's a matter of doing the things that we have to get the limb to the best state that it can be in, and then figuring out what we need to do then to keep it there.
And that's once again, and I think you're going to hear on the program a lot, is management. I mean, sometimes now you hear from the pest control people that, when you tent your home or you do this thing, it does kill all the termites that are there that day. But it doesn't kill the one that's going to come next week.
Right.
So the more you manage for me, the more likely I am to be able to enjoy life, walk around. Isn't that the big deal?
Sure. Yeah.
I mean, quality of life is what we're talking about here, because it's your legs most of the time.
Yeah. Right. And we use them all the time. But you're right. We handle venous disease in the same way. we don't really cure people of venous insufficiency because it's usually a genetically, predetermined kind of condition, and people who have it are very likely to have something come up in the future. We fix what is the problem at that particular moment, but we have to follow our patients closely, and usually we do that with yearly visits and ultrasounds. It's a constant, it's just persistence and maintaining good control. Basically it can be a very, very satisfying sort of process.
Yeah, and gang, the reason why I'm saying this is because you go to veinclinicsofhawaii.com and learn a little bit more about this. Not all of these things are elective procedures either. Some of these things they're health threatening. So, you get right in there and get approved and get a treatment plan going, because I think maybe, and I saw somewhere in the notes that what you have to do about this is that I'm hoping that there are sometimes, if your lymph system is in good shape, it might come to the aid of a venous insufficiency. It might, in some respects, that liquid's there for a reason, right? Mm-hmm. So if it's working well, and so my question is, can you have a good working lymph system and bad veins?
Oh yeah. Oh, absolutely. Yeah. There's no question. Many people have either one or the other.
Yeah, that's what I'm thinking.
But many also have both. And we struggle with that all the time. Because we like we mentioned before, we fix people's venous insufficiency and they still have swelling, and so they're going, "Hey doc, I thought you were going to fix this for me."
Well, yeah, but the same thing holds true when we talked about, if you talk about veins. You think, well, I don't know, man. I keep coming here, you keep taking care of my veins, and I get, they come back again. They actually don't, do they? You get different ones.
Yeah, the ones.
When you get rid of one, on me, it's gone.
Yeah, it's gone. Yeah. The way we treat venous insufficiency these days, it's a very reliable kind of procedure, and 95% of the time, that procedure does not need to be, redone.
One of the things, and maybe it's because we're in an instant gratification society, and I've asked you this before, but I also think that, because you mentioned earlier, there are certain types of medications, diuretics and things that you can and may need. But it doesn't look like either that condition or venous insufficiency are covered by oral medications at this point.
No. A lot of people come in on diuretics because their primary care doctor has started them for the swelling, and the diuretic will help the lower extremities swelling a little bit, but it doesn't take it away because there's a mechanical problem also. So that's the diuretic is kind of forcing your body to get rid of excess fluid, and as it does that, obviously some of that is going to be coming from the leg, but it's not going to cure the problem.
I got to laugh because I have a friend, and when we both went through similar situations with our physiques and both took charge of our lives and both got better. But for a long time, he suspected that he was using diuretics as a weight loss management system, because he kept eating and drinking the same thing that he always did, but the only thing is you couldn't hear him. At the end of the day, he had no voice, so he's always dehydrated.
Oh, okay.
Isn't there a danger to other organs by overusing that stuff?
Oh, definitely. Yeah, definitely. I mean, diuretics can, in the wrong situation, be tremendously damaging, especially to the kidneys.
Yeah.
You can overstimulate, or you can force your kidneys to get rid of fluid to a degree that it actually causes functional problems with your kidneys. So the diuretics are not completely
worry-free. But the thing that I like about it is that if you say, all right, well, if you eat and drink whatever you want to, and you take a shishi pill, and you stay, your weight stays the same, you will actually lose weight if you drink a lot of water. I mean, it seems like, why do I want to drink a lot of water? Because I just took the pill to make it go away. Right. That water that goes away is not exactly just really water. It's your body fluids, and the water that's coming in, last time I checked, 0 calories in water, right?
Right.
So you can drink a lot of water and not get any weight back.
Yeah.
Okay, so anyway, that's why I said, and it also bleeds through, excuse the expression, oh boy, it also bleeds through to other things where people are wanting the pill. They come in and say, Doc, I heard you do great things. You fixed my sister's leg. She looks great. I need a pill for mine.
Right. Yeah. Yeah. Well, that's a quick fix in many people's minds, but unfortunately, it's not quite that easy. But and there are getting back to the treatment of lymphedema, there are some surgical procedures out there. But they're not very commonly done. Let's say.
Yes, it sounds highly specialized.
Yeah. And not very many locations throughout the entire country are doing this kind of stuff. But there's lymph node transplants and there's other lymphatic kind of bypasses that people are doing with sort of mixed results. But there are surgical procedures out there. Just to answer your question that you had from before, but exercise. Exercise also is a very important part of the overall treatment of the patient with lymphedema. And
the other biggie word that you use all the time is elevation.
Sure.
And I'm thinking, because it's all in this big swimming pool at the bottom of your feet, right?
Right.
That if you elevate it, it's going to help everything.
Sure. Yeah. Elevation helps, just like compression, mechanical compression.
Yeah. So that means, gang, that there are lots of things you can do. I want to recommend again that you go to veinclinicsofhawaii.com. And it's a fun site. It's interactive. You can meet Doc and some of the staffers and some of the other people, and more importantly, hear about things that are, one thing is related to another thing and related to another thing. That's why a few shows ago when we talked about this, I thought, why don't we do a whole program on this? Because I think that if people can embrace the fact that they might have that in addition to the other symptoms they have, wouldn't it be worthwhile just getting it checked out?
Oh, yeah, definitely, yeah. There's a whole host of things that can cause swelling of your legs, as we talked about the other day. But lymphedema is probably one of the more common ones, and people don't really recognize it. Just like venous insufficiency, where swelling can be the primary complaint or the primary symptom.
I'm still thinking, though, that in some of the extreme cases that we have and we'll continue to be talking about, those that are a lot more threatening, being cosmetic or just sore leg, that are really a disease, is that the quicker you find out where in this 6 stages of venous insufficiency do you find yourself, and at what point in time can you parallel the lymph thing right next to that and say, what a bonus. I came in here for vascular opinion. I got a whole other system that I'm taking care of here.
Yeah. Well, and that's why we treat lymphedema, because it goes so hand in hand with venous insufficiency and vein problems, and it can be so much a part of the patients that we're treating. So yeah, it's really required that we're able to treat that.
Okay. So a question on the other end of it is when the person comes in manifesting these symptoms, and one thing that you are able to eliminate is lymphedema, that this person doesn't have a lymphatic problem. It has the right stuff. So that means that this problem is venous.
That would go without saying.
Yeah. So there you go. But once again, it zeroes in on the know-it-all ads. It's like my dad had it,
Yeah.
I'm worried that people ignore a very clear signal from their body saying, you know what? I'm telling you this, I'm hurting or I'm squeezing or I'm thumping or I'm dragging because I need some help.
Yeah, well, and it is a sign. That's exactly, your body's trying to tell you something. Again, it goes back to if it seems abnormal, it probably is, and there is a reason for it.
Are you, in your experience, in all your clinics, finding that there are some older folks that are not coming in for any other reason, but they have symptoms that prevent them from still working, because more and more people need to still stay employed, getting an income, whether it's for fun or whether it's for need. And somebody says, I don't know in the morning if I'm going to be able to go to work today.
Mm-hmm. Yeah,
I'm too sore.
That is becoming more and more of a problem. Sure, with each year that goes by, people are having to work longer than they used to, and maintaining your in general physical well-being so that you can do that is becoming important, more and more important, and leg health falls into that. Yeah. Sure,
I had one guy in particular that I thought I'd call out and see if you can close your eyes and diagnose this guy and get him on the road. This guy was a very successful banker. Did a great job. Put his kids through, great schools. His kids all got married, did wonderful things. His wife passed away, and he was in relatively good health, but bored. And, he had his 401k, he had his retirement, he was doing okay. But he said, I'm going to get a job. He became a greeter in a big box store. And then he became a guy that was passing out the free samples in a big box store.
Yeah.
Loving it. Having a good time. Try one of these. They're over there on aisle number 13. But 6 months after he started doing that, he couldn't get up. He couldn't do it anymore because his legs were killing him.
Right.
And here's a guy that obviously was so happy in interconnecting and having discourse with people during the day and chatting and passing. Who wouldn't be smiling when you give me a nice sample, right?
Sure.
He enjoyed it, but he had to quit.
Yeah, well, because probably before that, he was behind a desk his entire professional life.
He was a banker.
And then all of a sudden, he was on his feet, which is definitely will worsen all of these symptoms if you have that underlying problem, either venous insufficiency or lymphedema.
Well, the good news was that he went and got treated. And he was actually on the mainland and with his grandkids and his son or his daughter, whichever one, said, Pop, you're limping. What's wrong with you? Oh, no, I know, I'm not sore back. This guy realized that he'd been a tough guy, and he actually went to a doctor on the mainland. And the doctor said, well, he did what you do. He did ultrasound and blah, blah, blah. And now the guy is back at the big box store passing out the samples. And I think he's probably in his younger 80s.
Yeah. Well, that's good.
Isn't that nice?
Oh, that's great.
But the other guy that we need to talk about for a minute is not the guy that's got a fat retirement that's lonesome. It's the guy that has got to decide whether he can afford his meds or his rent or his food.
Right. And we hear that
quality of life
more and more all the time, and it's a shame. But there's nothing like maintaining good health from a young age, doing what you should to keep yourself healthy, and hopefully it won't come to those kind of things in the end.
Well, the good news is that the VeinCentersOfHawaii.com, you can get the fun stuff done, and you can also get the serious stuff done. And somewhere in the middle are where most of us have got to be. But one thing that I did learn earlier, and I think it would be a good way to end it, is that you have, through your expertise and your staff and the diagnostic equipment, to pretty much get to the bottom of what somebody's got, and therefore be able to sit down and not fix them in one day, but say, okay, Mike, here's what we've discovered. Here's what you have. Here's some of the options that you have. Let's talk about how you engineer and build and execute a treatment plan.
Right. People come in typically, with complaints about their legs, and no matter what it is, we can help them or direct them to where they should be. Mm-hmm. If they have a vascular problem, then we're certainly going to be able to
that's right up your alley.
Diagnose. And, if it's venous, we'll treat it. If it's lymphatic, we'll treat it. If it's arterial, we'll get them to a person who can treat it. Or if it's something else, if it's neurologic, if it's musculoskeletal, if it's joint related, people come in with a lot of different complaints in their legs, and part of our job is figuring out which complaints go with which process. Yeah, and so we have to sort through those things all the time.
Yeah, and that's why I said this, because in some cases the benefit is, while you're being treated for a vascular condition, a doc will say there's something else going on in here that you need to have a look at. Maybe you've got osteoarthritis. Maybe that knee pain that you thought was a deep vein thrombosis is not. It's a cartilage problem.
Right.
You got,
sure.
One rubbing against the other.
Yeah.
But the thing is, it probably took, didn't you say, a number of years for these things all to go wrong? So there's no reason you got to fix them all in 2 weeks.
No.
Yeah.
Or it's impossible to fix it all in 2 weeks. Yeah, because it was many years in coming. So.
Well, that's why I'm getting at. In the instant gratification society that we are, there some people you have to say, hey, look, Mike, we're going to go at the speed of light with you, but there's certain, you got to take a rest. Because I'm imagining that sometimes too many procedures might be a bit strain on the patient as well.
Yeah, sure, absolutely. And a lot of people don't really have, a full concept of what it is we do, and I think a lot, especially when it comes to veins, people think, it's all cosmetics. I'm going to go in, I'm going to see these guys, they're going to shoot me up with a little bit of this and that, and everything's going to be gone and fine, and I'll be on my way.
In a perfect world, like that guy used to say, right?
Yeah. It's just not like that. Usually.
All right, Doc, always a pleasure. We'll see you next time. And gang, I want to remind you that this program is being brought to you by the Vein Clinics of Hawaii. They are on the islands of Maui, the Big Island, Kauai, and here on Oahu. Dr. Julep is the medical director, and you can find out more about it right this minute. Go to VeinClinicsOfHawaii.com. VeinClinicsOfHawaii.com. And we'll see you next time. Thanks for being with us today.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, VeinClinicsOfHawaii.com. That's VeinClinicsOfHawaii.com.